Okay, so what else can we affect in the waveform? So we have the rise time. So this is the rate at which an individual wave travels from its baseline to its peak. Rise time comes into play when we start talking about accommodation. So accommodation is where the nerve fibers get used to the signal that is coming across. And if it's not coming across at a high enough intensity, it's not going to create the action potential to send on the signal. Okay, so when the stimulus is applied too slowly, tissues have the ability to diffuse the ions. So when we apply pads to the body, the electrons travel through the electrode, and then when it gets to the body, what travels is ions. So negatively charged ions are what's going to now carry this signal through. And so if we apply the stimulus too slowly, those ions can really disperse. And so we don't get enough potential, so voltage, right? Enough potential and current to push the signal through. So no action potential, no response will happen. So we want to make sure our rise times are quick enough for the various tissues we're trying to target, and different tissues will accommodate at their own risk. So nerve, which has a lower capacity, will accommodate sooner than muscle, which has a higher. And so that rise time is also related to decay time, so the time that it decreases, the wave decreases. Now rise time, like I said, sets up for accommodation. Another thing we can do is what I call duty cycle. So remember I talked about pulses, which is taking that waveform and for split seconds, nanoseconds, shutting it off and turning it back on so that the currents don't, or the electrons don't flow, and we get those individual pulses. Duty cycle is actually taking that whole individually pulsed waveform and shutting it off for something more measurable. So it's the on-off time, and we use it most often with muscle re-education. We report it in either a percentage or a ratio. So your duty cycle might be 25%, so it's on 25% of the time, off for 75% of the time. Or you can do like a 1:5 ratio where it's on for 10 seconds, off for 50 seconds. So we use it most often for muscle re-ed so that we don't get fatigue in the muscle, and we can actually use that downtime to work on them actively contracting the muscle. We can also potentially use it if a patient's really wary of a treatment and we just want them to kind of get used to it, but they're not going to get the full effects of the treatment if we do it that way when we talk about our sensory and our pain relieving treatments. So talking back to our anatomy of the pulse, so here's our rise time. So again, that's going to be the time it takes to rise up to the peak. Our decay time is going to be the time it takes below. And so I mentioned that we have the difference between creating the pulse and creating the duty cycle. And so here, what we see with D, this is what we call the pulse period. So it takes into account that whole pulse duration, so the two phases, and the interpulse interval, which is different than our duty cycle. Again, this is inherent in the waveform. We won't really mess with this. What we would set would be a duty cycle, which would be this pulse happening many, many times over 10 seconds, and then being the entire current gets shut off for 50. But so when we talk pulse period, we talk about that, the pulse duration plus this interpulse interval. So in monophasic, where the phase and the pulse are the same, our pulse duration, our pulse period, would be the pulse or phase duration plus this interpulse interval. So like I said, another part of the wave is the frequency. The frequency is going to be, we talk about frequency in kind of two different ways when we talk about anatomy. And it's just confusing, and I apologize for that, but there's no real good way around it. We divide frequency in machines into low, medium, and high. And so that when we talk about low frequency machines or generators, those are ones that are less than 1,000 hertz. Mediums are between 1,000 and 100,000 hertz, and high is greater than 100,000. And so remember, frequency would increase the amount of permeability kind of the lack of resistance, we can really move that current through with higher resistances, or I mean higher frequencies. Now, just to confuse things more is, so we have these different generators, the machines that are producing low frequencies, so less than 1,000 hertz, medium ones, and high ones. Most of our units, most of our E-stim waveforms are going to fall under this low category. And then within there, we call something low rate and high rate, which, like I said, is just kind of confusing. But if you break down this level, the lower ones, sometimes called 1 through 5, sometimes called 2 through 10 hertz, those are going to be ones that are going to, when we start talking about our pain control, our level 2 and our level 3 pain controls are potentially going to be there. NEMs, we're going to talk about 30 to 70 hertz. So again, kind of in the middle of these. And then high rate is 60 to 100. So if we talk about a low frequency machine, we're talking about under 1,000 hertz. If we're talking about low rate and high rate, we're talking about specific types of tens that usually sit somewhere in these hertz levels. Okay. Medium frequencies, that's when we start talking about our interferential current and our Russian. So they're going to have easier penetration because they're going to be this higher frequency. And we'll talk about how we get to use those higher frequencies and not damage the body. And then high ones, there's none that we really use. These are more used in industrial settings or things like that. We don't use them for therapeutic purposes. And then, as I mentioned when we talked about the constant velocity of light, wavelength is indirectly controlled through frequency. So we can adjust these frequency rates, and then by adjusting those frequency rates, we automatically change the wavelength because the speed of light doesn't change. So if we move from a high rate to a low rate, so we decrease the frequency, the wavelength is going to increase in order to compensate for that.